Why don't each of you just give a quick 1 minute overview of what you currently do and what you've been doing the last 10 years, just to update everyone who is not familiar with you. Dr. Hashmi, would you like to go first?
Sure. So my two areas of specialty, one is kidney disease and the other one is obesity medicine. And for both of those areas, I've been doing that now for the last couple of decades. And essentially, a lot's changed since I started in the field in both areas. But that's my pride and joy.
Okay, and Dr. Goldhammer?
True North Health is a facility that specializes in nutritional medicine, in particular medically supervised fasting. We treat a variety of people using this methodology. We're also an active research center. We've published a number of papers, and we're doing some ongoing clinical trials looking at how to do what we're doing better.
Okay, great. Thank you. And thank you both for joining us tonight. And both of your individual lectures were wonderful and very informative. So we appreciate you sharing that information with us. So I'm 60 years old. And when I was in my 20s, for whatever reason, I don't know why, I didn't have proper dental care. I skipped on flossing. I skipped on cleanings. I was kind of irresponsible. I'd eat a pint of ice cream and didn't take care of my teeth properly. And one day it turned out that I had 6 cavities, a couple of root canals, and all these problems with my teeth. And I went to good dentists and they did the best they could. But even to this day, my teeth have been affected by how I took care of them in my 20s. And I wish someone somehow had told me in my 20s everything I needed to do so I could have avoided those problems easily. A lot of us would like to not make mistakes like this. And we certainly don't want to make mistakes with things like our kidneys or our health overall. So a lot of the information we get, it's from the newspapers, it's from the news, it's from mainstream sources. And a lot of the times they're not really giving us the best information, the most accurate information, and they're putting our health in danger. And we don't want to have our first discussion on health and diet and kidneys when we have a problem. We would like to know before so we can have a chance to take I think, whatever action is appropriate. So the purpose of this conference, the purpose of this panel is to make sure that we didn't miss this, that somehow that we know exactly what the best science and research and your experience says so that we could make sure that we don't end up having a problem that's easily avoidable. So that is what we're thinking. That's why we're here. And we're hoping that your years of experience and all your hard work to find the truth is going to save a lot of pain and suffering for all of us. Okay. So to get started, Dr. Goldhammer, I think you've said that you've treated over 20,000 people with fasting. So I guess the first question is, okay, so what happened to these 20,000 people? When you fast, do you always lose weight? Does it lower your blood sugar? Does it lower your blood pressure? Does it cure other diseases? Does it all go away as soon as the fast is over? Like, what has been the result of these 20,000 plus fasts that you've done? What have you learned that you could share with us? What is all this knowledge and experience that you've gained from 20,000 plus fasts that we could learn so that we don't, we would like to get the benefit of whatever you've learned. So what have you learned?
So health is the result of healthful living, and healthful living involves diet, sleep, and exercise. So if you want to be healthy, you have to pay the price. And that means, controlling what you put in your mouth, because dietary excess leads to excess fat leads to excess visceral fat leads to inflammation leads to heart disease, cancer, diabetes, and premature death and debility. So what I've learned is that if you want to get patients healthy, they have to do those 4 basic things. They have to eat properly, they have to sleep properly, they have to get enough activity. And when dietary excess has been an issue, fasting can be a useful tool of reversing that process. As far as diet, we have specific recommendations, a whole plant food diet that's free of salt, oil, and sugar. That's a rather extreme version compared to what is generally advocated out there. But in our experience, that works really well. Exercise, we encourage people to engage in a variety of different activities rather than just necessarily one specific activity. So walking, hiking, biking, swimming, done most every day. And sleep, we think, is one of your most important activities so that you get to sleep at a consistent time, sleep long enough that you can wake spontaneously feeling refreshed. In my experience, people that control diet, sleep, and exercise maximize their health potential.
Okay, thank you. Dr. Sean, what is the correct pronunciation of your last name so I pronounce it correctly?
It's Hashmi.
Hashmi. Okay. So, Dr. Hashmi, you've been doing this. You've been giving advice. You've been dealing with real people. What have you seen happen? Has the diet, lifestyle, sleep, exercise work? Does it prevent people from getting chronic kidney disease? And so, first question is, does it prevent it when people follow this advice carefully? And when people already have it, how effective is it in reversing it?
Yeah. Before I even answer that, I'll go back to something you said earlier, which was the goal of this is really to make sure people know what to do right now. I would challenge that notion a little bit and say that the thing that we see is we can have all the information ready for people. It doesn't necessarily mean they will be following it. You can walk into a grocery store right now, and there's an entire section of beautiful, fresh fruits, vegetables, and it's all the way to the side. Now, all you have to do is, instead of walking straight in the grocery store, usually go right or go left, depending on your store, and you will hit it. The reason I point that out is oftentimes when we talk about change, we're talking about the what. But we forget to mention the most important part of change is not the what, it's the why. Why do you want to change? Why now is so important to you? And as a kidney doctor, I can tell you the number of patients that have died because of diabetes, because of high blood pressure, because of just plain weight is insane. And all of those patients, for years and years and years, I had those conversations. I was begging, I was pleading them to change. And so this is the toughest part of what we do is not so much understanding what we need to do is convincing people that they need to make that change in the right manner. So what Dr. Goldhamer mentioned, I have a nonprofit called Self Principle, Sleep, Exercise, Love, and Food. And when we look at kidney disease, the three biggest causes of kidney disease, once again, diabetes, that's the #1 cause, high blood pressure, and obesity, which kind of encompasses the whole 9 yards. Now, we know that if you focus on sleep, if you focus on movements, if you focus on gratitude, kindness, do something to get rid of the stress for yourself, and you eat a predominantly plant-based diet, you're covering 90% of what you need out there. There's autoimmune conditions. There's certain things where you have no control over. It's completely understandable. But the information that people need, especially today, it's available. I talk about ACLM, or the American College of Lifestyle Medicine. When I went through training, ACLM didn't exist. There wasn't anything as ACLM. There wasn't a group of dedicated, passionate doctors reviewing the literature, creating the literature, peer-reviewed studies that are being published right now. It was funny, when I did my panel, they were asking the question about, what is it that you would want people to know about your recommendations on a diet? And I said, what's interesting is if you'd asked me this question 10 years ago, I would say what I'm proposing is blasphemy. It's hearsay. Now, in the National Kidney Foundation's guidelines, a plant-based diet is listed. How incredible is it that on the mainstream, we know what we ought to be doing? And yet, day after day, in the inpatient side of the hospital, I see the same stuff happening. Patients who are spiraling. The 5-year risk of death on dialysis is still 50%. 1 in 5 people each year will die on dialysis. And so when we talk about this topic, it's so difficult to talk about because we're not talking about numbers. We're talking about people who have mothers, fathers, brothers, sisters who are losing them. And yet we still can't convince the public. And probably the greatest sham that was ever pulled on the public was to take the word plant-based and make it mainstream. We took a beautiful concept that amazing doctors who are working on it with the right stuff, dietitians, all sorts of health people working on it. And then we said, how do we commercialize it? How do we create packaged foods that is incredibly processed, loaded with salt, loaded with every bad thing you can imagine, but it says the word vegan or it says the word plant-based on it. And we convince people to change their diets. And that's why it's not so much the what, it's helping people to understand the why.
During Dr. Hashmi's lecture today, he said that instead of focusing so much on being right, as a person, instead of making your goal as a human being to be right all the time, focus more on being kind. Now, was this just a nice thing to say, or does this have something to do with health also? Like, is emotional health, us being kind, compassionate, empathetic, loving, a real thing? Is that just a nice thing we're just saying because it's nice? Or does this have something to do with our health also? For both of you, you can answer that.
I'll share a quick story. And Dr. Goldhammer is so respected in the field. So, he has far more experience around this. But there was a fascinating study. This was done in Rosenton, Pennsylvania. There were two groups of coal miners. Both of those groups, they came home every day. They both smoked, drank like crazy, ate the worst foods. Everything was fried and then fried again to make sure they missed like 1 square inch of it. And what was fascinating was that, they all had relatives in common, but one group kept dying of heart disease. They had heart attacks, strokes, you name it, diabetes, kidney failure. The other group, surprisingly, wasn't. And so researchers were puzzled. They looked at these both groups and they were very close in the proximity to each other. The only difference they found, and this is why it's so fascinating, the only difference they found was one group, they smoked, they drank, they ate every bad food, didn't exercise, but did everything alone. The other people, they did everything together. So even though they were doing bad stuff, they were doing it in the company of people who loved them. This has been replicated in animal studies, where there's been animal studies literally where it was done in rabbits, where rabbits were exposed to this extreme stress environment to see how they were responding. And there was one group of rabbits that kept living longer, even though they were being fed poison. And you know what the only difference was? That every day when there was a person, this little researcher who would go in and pick up the rabbits, this gentleman would pet the rabbits. That's literally the only thing that this guy was doing, was he was petting this group of rabbits, because on his shift, he felt really bad about their future. So the word kind is fascinating. One, expressing kindness to the other person can change their life. And as a healthcare provider, I can tell you, when you see a patient, you have no idea the trauma they're going through. None of it. I saw a patient who had been going from doctor to doctor, never being able to lose weight. And the underlying reason she couldn't lose weight was she was badly beaten and abused by her significant other. And the reason she ate was because that was her best friend. And number two is, when you express kindness, we know from data, very well-designed studies, not one, multiple studies that show that your own stress hormones go down, your blood pressure calms down, your heart rate calms down. So if you truly want to live longer, all you have to do is be nice to people, and they'll feel better and they'll live longer as a result of it. And in return, it will calm you down. The simple act of gratitude is one of the most underrated medical treatments out there.
Thank you.
So, I think that, stress is certainly sometimes an underrated influence on health, and constant high-grade stress clearly is associated with hormonal productions that's counterproductive to health. I think that in addition to trying to be kind and act kind, you can also work on controlling your environment and trying to put yourself into an environment that's more supportive of effective social interaction. For example, people spend a lot of time stressing out about things they have no control over, which is particularly unproductive. In other words, they'll watch the news and watch all the terrible things that happen to people throughout the world every day in living color. You can be a fully informed citizen and not spend inordinate amount of time dwelling on things you have no effect on. I think we're much better off trying to spend our emotional energies in dealing with things that we have some influence on, the people that we meet, the people we like, the people we love, and try to create an environment where we spend more time with people that are supportive rather than not supportive. And that means learning to say no and learning to, not allow guilt or other types of manipulation regulate what your behavior is going to be. So I think this is a big subject. It's complicated. I'm certainly not an expert in psychology. I would defer to people like Dr. Lyle and others that really make their living studying this. But I do think that whatever you can do to create a more health promoting environment is likely to translate into physical as well as emotional benefits.